Hi crew, this is Ken from WildMed Kits, and we wanted to make a quick video today going over EpiPen purchasing and use in Canada. So not everyone knows that you can actually buy an EpiPen in Canada without a prescription. You can go to any pharmacy and purchase one. I just did one today just to test that to make sure it's still true, and there's lots of resources online you can find to defend this. So here's the EpiPen I bought today from a local Rexall, and the cost for me was $132.29 Canadian. So just for an idea there, I imagine they're going to run about the same price regardless of pharmacy you go to here in Canada. And they didn't ask me any questions. I just walked in, said I wanted an EpiPen, and they gave it to me. So why you might want to carry one is particularly if you're around people with allergies and you want to have a backup pen to assist someone else, or you're working with kids that maybe don't have diagnosed allergy conditions and you're trained in the use of this device and certified, then that's a great time for it. Particularly if you're like in a teacher role, in a guide capacity, doing expeditions, maybe you're traveling elsewhere in the world and you want to have this as a safety. The nice thing with the EpiPen is there's not really a lot of harm you can do with this device. Obviously, it has a needle and it can hurt a bit, and you definitely want to inject it in the correct location. But if you gave it in error, it's not going to have a detrimental side effect. This is a life-saving drug, and you really can't replace this. There's a lot of myths around anaphylaxis, which is the condition that the EpiPen treats. That's the severe allergic reaction. And that's in which people say that you do not need this pen. You could just use other medications for asthma like inhalers or oral medications for allergies such as Benadryl or Reactin. And that's untrue. In true anaphylaxis, the only medication that's going to help solve that problem is the epinephrine in the EpiPen. So this is the EpiPen here. I just wanted to show you what it looks like. Here's the box. This is the 0.3 milligram, which is considered the adult version. And that's for anyone over 33 kilograms or 66 pounds. If your participant is under that weight, you're going to want to use the EpiPen Junior. So you ask for an EpiPen Junior. That only has half the dose, which is 0.15 milligrams. And that's the dose you would give for someone that weighs less than 33 kilograms or 66 pounds. So let's take a look at this. Here's your casing. They have expiry dates on them. The one I purchased today, and today is February 27th, 2025. This expires June 30th, 2026. So it's about, 18 months, year and a half kind of thing that you're getting. And we'll open it up here. So opening it up, this is what you get. It comes in a clear case. This is not a waterproof housing, but it just helps keep it protected in your pocket. If you open it up, so this is the real EpiPen. This EpiPen has instructions printed right on the pen, and you can see that little window there. That's where you can view the medication. It should be clear as it is like that. It shouldn't be yellowed or discolored, and that just helps to show that the medication is in generally good working order. There is also an expiry date written on the pen itself. The main thing with these is that you want to store them at appropriate temperatures. So this says store at room temperature or 15 to 30 degrees Celsius. Do not refrigerate or freeze, and protect from light. So if you have those exposures, that may damage the device itself. There are many videos online on how to use these, and epipen.ca has some really good resources. So I'd suggest checking that out, and I've added some resources in the link below in the comments or the description for this video. In general, this orange end is where the needle comes out of. You should never place any sort of finger over that end. Anytime you're operating the device, always hold it with your thumb inside. That way, even if you put the wrong end, that's not the correct one, on the patient, it's not going to fire, and it's not going to accidentally fire into your thumb, which is a big issue with these pens. Okay. To use it, you pull off this blue safety cap, and then this is a pressure censored trigger. So as soon as it meets the right pressure on the thigh, it will administer the needle, and you need to hold that medication in for a minimum of 3 seconds. So you're going to count out 1, 1,000, 2, 1,000, 3, 1,000. Then you can remove this from the patient, and there will be a covering that covers the exposed needle just for safety of the responder. So what I'm going to do, I have a demo device. I'm going to put the real one away just so I don't inject myself. So we're putting the real one back in its box where it's going to stay for now. And I'm going to pull out a training device So we sell these training devices at wildmedkits.ca if you'd like to purchase one. So this is the training device here. The main difference is it says training device on it. So I want to show you how to administer this correctly. So I'll get down here. Main thing is that patient positioning is important. They should be sitting or lying down. So I'm going to take a seat for you. And the big problem we see is people administering it into the wrong location. So it's supposed to go in the anterolateral thigh, which is the outside of the thigh. So you got your knee to your butt. You're aiming for the middle section here on the outside of your leg. It can go through clothing, but it cannot go through objects or zippers. So before you blindly swing this thing in, all you need to do is find a location that's thin clothing. Just place it, press it till it clicks. Okay, to arm the device, we have to remove the blue safety cap. So we've taken that off. And again, we're always going to hold it with our thumb on the inside. We're going to find a location where there's no other objects sitting around and it's just thin clothing if we can't remove the clothing easily. We're going to press it till it clicks. Hold it for 1,000, 2, 1,000, 3, 1,000. We're going to remove the device. You can see now there's the protective cover that would cover where the needle would be in a real device. And we can rub this area. Now we need to make sure that at this point that patient is followed up in a hospital. So we're going to go ahead and call 911 and let them know we have a patient that had an anaphylactic reaction and we've administered an EpiPen. Hold on to your used EpiPen and give it to the paramedics when they arrive. That way they can confirm dosing. And it's ideal to note the time you gave the medication. Just as an overall review, we are giving this medication for a condition called anaphylaxis. Anaphylaxis has a very, very nice summary definition that I'm always happy sharing with others, which is a patient's exposure to a known, like they have a diagnosed allergy, or suspected allergen, and most commonly that seems to be foods or insects. So nuts predominantly make up a large component of that anaphylaxis, as well as insect stings, wasps, bees, that kind of thing. People can be severely allergic to other things, but those are the vast majority of the anaphylactic reactions. If they're exposed to those things, we need to see 2 or more body systems react to that exposure. And that can occur very quickly or it can occur over time. What we're looking for, the 4 systems that may show a reaction. Number 1 is the respiratory system. So you may have someone have difficulty breathing. It's harder to get air in and out. They're feeling those lungs being tightened. They may even make that wheezy sound or like a stridor sound as that upper airway is closing up. They may have swelling to their tongue. They may have difficulty speaking with that as well, or swelling around the lips. The second symptom we most commonly see is the skin system react, where people break it out in red bumps called hives, and they're generally itchy all over chest, abdomen, back. It could be arms and legs as well, but it's not a rash specific just to the area where the allergen was introduced. It's generalized, which means all over. The third system we often see is the GI system. So this is where you might have a patient feel sick to their stomach. They might be nauseous or vomiting, and they may have diarrhea as well. And the last system we're looking for, number 4, is the brain. And what we're looking for here is a lack of blood flow to the brain, which can occur in anaphylaxis. And that's going to show by lightheadedness, dizziness, confusion. They feel like they're going to pass out. That would be the symptom. So 2 or more body systems with known or suspected allergen, that's anaphylaxis. You're going to go ahead and help that patient with their EpiPen. If they can do it themselves, fantastic. If they can't, by all means, if you're trained, go ahead and help them out with it. It's totally safe to do. Just watch your thumb. And the big follow-up with this is make sure you've called 911 EMS and you're having that patient further assessed in the hospital for the next steps of treatment towards anaphylaxis. Thanks for paying attention, crew. If you want an EpiPen, again, you can see any local pharmacy to purchase one for yourself. Stay safe out there. And if you're looking for any first aid kits or supplies, check us out at wildmedkits.ca.